Hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're having a good day, a good week. I certainly am. It's fantastic. I'm helping a lot of people this week and I really enjoy that. That's what makes me tick. You know, our motto at Nightingale Dementia Consultants is, if you turn a frown into a smile, you've done a fantastic job. And it doesn't matter how you turn that frown into a smile. Just go out there and do it. Just pass somebody in the street and say, hey, you look nice today. Or, hey, what a wonderful pair of shoes you've got. You know, just something nice, something that people are not expecting. Just go out there and make people happy. We never know what's going on in other people's worlds, in other people's lives. So when they hear somebody, a total stranger, pay a compliment, it's usually greeted with some pleasure and some joy. So do that. Today, on this video, I want to talk a little bit about diabetes type 2, how it impacts on Alzheimer's disease, what is the implication there, how metformin and other anti-diabetic medicines may be of benefit, may be helping, and also to make sure that you are checking on a regular basis your glucose and your ketone levels. You can get the machine to do that. There's a machine called Keto Mojo, and that will measure both your glucose and your ketones. And it's really important to know, you know, how you're doing with those things. So let's get into it. Diabetes type 2. We know, and we've known for quite some time now, that diabetes, living with diabetes, is a contributing factor to the development of Alzheimer's disease. In some quarters, and this is inaccurate by the way, but some medical professionals will refer to Alzheimer's disease as diabetes type 3. Please try to brush that away because it isn't strictly accurate, okay? But there is a huge correlation between diabetes and Alzheimer's disease. This is why it's important to monitor your glucose. If your glucose levels are above 100 or 150, then you need to change something in your diet. And one of the things that people have thrown into everything is sugar. Sugar is in everything. In America, there are substances in foodstuffs that are banned in Europe, but in America, we're expected to eat it. So, go organic, as much organic as you can. Look for added sugars in foods. If there's added sugars, avoid it like the plague. Nothing needs added sugar or added salt. Nothing needs it. If we go back millions of years ago when we were hunter-gatherers, there was no sugar. We didn't have sugar in anything. The APOE4 gene is something that some people carry, many of us carry, and it is one of the contributing factors to developing Alzheimer's disease. If you have an APOE4 gene, you'll have a higher risk of developing Alzheimer's disease. However, 2 million years ago, all we had was an APOE4 gene. We didn't have the other two, which is 2 and 3. They didn't exist. All our ancestors had was the 4. And because of their diet and their lifestyle, there was no dementia, there was no diabetes. So this is what modern food has done. The modern diet, and especially the American diet, has really messed with our bodies, our systems. We need to be glucose sensitive. Many people, I think that there was millions, I read the statistics the other day, millions of American people are resistant. So glucose resistant. So you can pile all this sugar into your body and it's not doing anything other than causing you to be sick and increasing your risk of diabetes. We need to be insulin sensitive, not insulin, sensitive. We need to be sensitive, okay, not intolerant. So think about your diets, think about what you're eating. Fat is okay. the governments throughout the global world, throughout the modern world, has told everybody that fat is bad, it's unhealthy, stay away from it. No, untrue. They're now reviewing that and changing their thought processes around that as well. There are many, many healthy fats. Avocado being one of them. That Lynn, you love avocado, don't you?
Yep.
And avocado is not something that I've eaten in the past, but I'm now introducing into my diet because I realise how healthy that is and how good that is for your system, for your body. So monitor your glucose levels, monitor your ketones, and the ketones, that's another important thing. What we're seeing today is the ketogenic diet is absolutely brilliant as a preventative towards developing a dementia type illness such as Alzheimer's disease. If we already have Alzheimer's disease or other cognitive disorder, then shifting to a ketogenic diet or the mind diet is what you need to be doing. So we can manage and we can bring our glucose levels right down by cutting sugar out of your diet. Get rid of it. Stop eating cakes, pies, putting sugar in foodstuffs. Don't use it. Stay away from it. Clear it from your diet. It'll take a bit of time to get used to not having sugar, but eventually you will get used to it and it'll just become second nature to you. If you do need to use sweeteners because you just cannot tolerate not having sugar, use something like stevia, which is a natural sweetener. It's not processed. Stay away from processed food. Processed food is what kills people. Processed food is absolutely abhorrent for the body. It doesn't like it, and the brain cannot tolerate it. So cut processed food out. Eat fresh food, organic as much as it possibly can, and stay away from the sugar. Diabetes, as I said, diabetes type 2 is something you can reverse. You can actually reverse it by changing your diet, changing your lifestyle, exercising. Now, I always talk about strength training. Get in the gym, pump some iron. Also do some aerobic exercise. Running is really good for you. I struggle with it myself, but it is a good form of aerobic exercise. Yesterday, some of you may have seen that I posted something about dancing. Dancing is fantastic. I mean, you look around the world at dancers, professional dancers, and they live for so much longer. Their longevity is amazing. Healthy. They're fit and healthy as they live into older age. So incorporate a bit of dancing into your daily routine, into your daily life. 5 minutes, 10 minutes, 15 minutes of dancing. And there's a saying out there, I don't know exactly how it goes, but it's something like, dance as though nobody's watching you, dance like a crazy person, just dance, dance away. And we know that the chemicals that are released during exercise reduce depression massively and releases all those happy chemicals that we need in our brain. So, change your diet, change your lifestyle. You can reverse your diabetes. Do not drink soda, nada. Sugar-free, just as bad as the full sugar stuff. Stay away from it. Drink water. Water, of course, is very healthy for you. Water is absolutely brilliant. The second thing to think about here is coffee. Coffee is becoming more and more widely regarded, as something that can reduce your risk of developing Alzheimer's disease and Parkinson's disease. So every morning, without fail, I have a small shot of black coffee with MCT oil in it. MCT oil is a great thing to help manage your diabetes if you have it, but also your ketone levels. Ketone levels need to be between 1 and 4. That's optimal, okay? If it's lower than that, people function less effectively at a cognitive level. So bear that in mind as well. So they're looking into how anti-diabetic medicines might improve cognition, might in fact improve memory. So, and there's lots of research going on with lots of different things, lots of existing medicines, we've got new medicines, but you know, medication is not a standalone treatment. Brain health therapy, psychotherapy, hypnotherapy, managing trauma, managing your stress in life, all these things contribute or can contribute to developing Alzheimer's disease, heart disease, diabetes. So I want us to think about that, and I want us to reduce our risk of developing Alzheimer's disease through diabetes. Lynn's here with me today, as always. Do you have anything to ask or anything to say about this topic?
Well, I'd say if you haven't had any blood work done in more than a year, you should get to your primary care or GP and get your blood work done so they can check all your levels. If you're curious and want to know, like he said, what your ketone level, what your glucose level is, I think that's something everybody should have available to do at home, just like a blood pressure cuff.
Yep.
Because you want to check if your glucose, like he said, is over 100 or 150, you could be either diabetic or pre-diabetic. So it's a good idea to find that out and know where you stand, to know what changes you can start making, because you can take control of it.
And of course, it impacts on your blood pressure as well. So you develop hypertension. Now just think about how hypertension and how a change in your blood chemistry impacts on your behavior and on mood. You know, this is the thing, psychologically and mentally, our physiology is impacted. So our physiology will impact our mental health. So think about that as well. If you start losing your patience, if you start losing your temper easily, if you become very short-tempered, if you become very irritable and all those kind of things, check your glucose levels, check your ketones, check your blood pressure. Because again, if your blood pressure is too high, those things can happen. If it's too low and your glucose is too low, we have the opposite effect, of course, don't we? So we need a blood pressure that I think we're beginning to widely accept now, that 130 is okay. 120 was always the standard, and you'll still see that as a standard in many places. But, you know, 130 over 80, 85 is okay as far as I'm concerned. I accept that. So, yeah, great point, that one. Absolutely.
And also, there's a lot of water substitutes out there available. There's a lot of drinks that are carbonated and say they don't have sugar and they don't have added sugar, they don't have chemicals or flavorings, but read the labels of what you're buying and what you're putting into your body, because like he said, plain old sugar is the best. Stevia would probably be second best, and then anything other than that is probably not good. High fructose corn syrup, aspartame, saccharin, sweet and low, Splenda, none of those are any good. Basic water is okay. So for example, there's these other products that are packages of flavoring to put in your water. Read the labels of those products as well, because they also contain a lot of weird sugar substitutes that aren't healthy, so you want to steer clear of those as well.
The other thing about that, Lynn, as well, is that they contain phenylalanine. Now, when a baby's born, we do a heel prick test to check their levels for that. And some people are diagnosed with fetal ketonuria, PKU, which can lead to learning disabilities, developmental disability and stuff like that. And so check, don't just read labels, but also research it. Because certainly in the US, there are labels that will say something isn't in there, but if you research it, you'll find that there is a small amount of it in there. So if it's below 0.5 milligrams, for example, they might not put it on there. So, and it adds up, doesn't it? So always research it. Don't just believe the label, research it as well. If you take foodstuffs with phenylalanine in it, I can never pronounce that word, especially with post surgery. Phenylalanine leads to fetal ketonuria in babies, so we've got to avoid that and avoid it as you're aging. And also aspartame. If you have a little bit of aspartame, it's okay. If you are having a diet that is high in aspartame, and some sodas have aspartame, and some of the powdered water flavours that Lynn referred to there also have aspartame, it can lead to younger men not being able to have a baby. So stay away from aspartame, stay away from sugar, think about healthy fats, think about enjoying a good healthy diet. And I know that sometimes people say it is more expensive to eat healthy than it is to go and get fast food and all that kind of stuff. But long term, no, it isn't. It's impacting your health. And my job, part of my role as a clinical dementia specialist is to educate people with the aim of reducing their risk of developing it. And then if they do have it, treating it and trying to reduce a lot of the symptoms through diet and nutrition and through a healthy lifestyle, exercise, brain health. Never forget your brain health. People will exercise and forget about the exercise of the brain. Your brain's a muscle. It needs as much exercise as your bicep. So do that. And it's also good if you're walking to do some brain health stuff. So when you're walking, count down from 100 in 7s or 6s or 5s, whatever it is. Count down from 100 in it. Do the alphabet backwards while you're walking. Think of words that you can spell backwards while you're walking. What I'm seeing lately is research suggesting that if you incorporate brain health exercises whilst doing some physical exercise, it has an even bigger impact. We are pumping fresh oxygen and blood to our brain. One of the markers, one of the indicators of Alzheimer's disease in a head scan is reduced blood flow. So by doing all this exercise, aerobic exercise with the walking, you are pushing the blood. You are giving your brain good blood, good oxygen, and it's healthy and it's good stuff. We are a nation of obese people. There are millions and millions and millions of people who are obese across the globe. We have to change that. We have to change it. Thank you very much for listening to me. Have a fantastic day, have a fantastic week, wherever you are in the world. I hope you're having a good life. Please share this video with all your people in your circle. Follow me on Facebook, follow me on Instagram. You can find us on Google. You can email me or Lynn, Dr. Dan at drdanielnightingale.com, Lynn at drdanielnightingale.com, our website, danielnightingale.com, drdanielnightingale.com, and you can find out so much information. Any questions, feel free to ask us. Have a fantastic day, week, wherever you are. And remember, say it with me, ladies and gentle peeps, dump the soda.